Hello, and welcome to another episode of the Gritty Hour. Today I have a special guest, Jill Sitnick, who, the Journey Sage, she goes by. She's the author of Rescuing Jill, which is a book about her own experience and how she treated her anxiety and PTSD with MDMA therapy. Welcome to the Gritty Hour, Jill.
Oh my gosh, thank you so much for having me. It's a pleasure.
It's a pleasure to have you. So, before we go into anything in depth, just explain for our listeners and viewers what MDMA therapy is.
Sure. So MDMA is a psychedelic. Your listeners will probably know it more as the street name ecstasy or Molly. Unfortunately, ecstasy and Molly can be cut with any variety of things. For a therapeutic use, it's pure MDMA, which was synthesized in the early 1900s. And MDMA in a therapeutic environment is a patient along with two trained individuals. In my case, it was a therapist and a guide. And over the course of a 5 to 8 hour journey, a patient suffering from PTSD can have his or her amygdala, the fire alarm of the brain calmed down, and so that the patient can start to deal with the fear around the trauma that is causing the PTSD. So that might be the shortest description of this therapy. I'm sure we'll get into it as we get further along.
Yes, we will. What does MDMA stand for? Do you know?
Oh my gosh, it is. It's
Clinical word? Okay. Yeah.
yes, it's
All
a
right.
multi. I can't even begin to pronounce it. If
I
you just
understand.
internet search for MDMA, you'll get the real name. I will butcher it. Yes.
That's all right. So we'll stick with MDMA therapy.
Yeah.
So tell us how you got involved, what brought you to that, and you do have PTSD, you said, or you treated it. You
I
don't have it
treated it.
anymore. Okay.
Right.
You can
Right. That's why we're
successfully.
talking.
Yeah. No, but you
Yeah.
can you can say successfully that you no longer have PTSD. So
Right.
that makes me very interested as to how you got to that point.
So let's just lay a baseline that I
Hmm.
am talking about an underground therapy. The FDA in August just delayed approval of this therapy for a variety of reasons. So we're still talking about underground, which was how my treatment was. So I just want to kind of set the bar that we're not talking about something that somebody can go ahead and Google and just sign up for right now.
I got you.
With that said, I fell into an opportunity for this therapy. In my late 40s, my husband, my partner, Carl, passed away,
I'm sorry.
and I wound up going to a therapist to deal with the grief. 18 months after his passing, I was starting to come out of the grief, and I wound up getting a work email that started a PTSD reaction in me. I was 1,000% sure that within a month, because of this work email, that I was going to be living on the streets.
Hmm.
And my body, my stomach was upset, my shoulders were tight, I was having trouble sleeping, my appetite was wonky. The feeling in my body was like when you're really terrified of something, maybe getting up to speak in front of a group, or heights or spiders, whatever it is you're afraid of,
Hmm.
that feeling in your body is what I started to experience all the time.
Hmm.
I went back to my therapist who had helped me with my grief, and because she always let me kind of pick up and put down therapy. And I started to explain my symptoms. And she did a really odd thing, I thought at the time. And she kind of asked me to start listening to my body. And as I was kind of focusing on the symptoms of my body, childhood memories came up. And I'm a Generation X gal. We didn't really talk about trauma. I knew I didn't have a great childhood, but I also knew other people had way worse. Long story short, I never dealt with my abusive father, my suicidal mother. I just kind of like packed that all away.
Hmm.
It kind of the trauma from my partner's passing kind of brought it all back in the form of a PTSD symptomology. And after a few months of talk therapy, and I was also on Wellbutrin, which is an antidepressant at the time, after a few months of that treatment, I was not getting better. And My therapist gently pointed that out. She said, look, go read The Body Keeps the Score so that you can understand that you are appropriately reacting to the trauma that you're telling me about as a child, because I hadn't
Hmm.
shared that with her before. And go look at the research at maps.org, maps.org.
Hmm.
This is a mouthful, get ready. MAPS stands for the Multidisciplinary Association for Psychedelic Studies.
Hmm.
Those are the folks who have been running the clinical trials for MDMA for PTSD with a focus on veterans.
Ah,
At the time, because this is a couple of years ago, they were on the phase 2 clinical trial. And on average, I was an English major, so I round everything. On average, I saw that 2/3 of the people who had completed 3 rounds of the treatment no longer qualified for a PTSD diagnosis, meaning they
wow.
were no longer suicidal. They saw hope in their future. And because I wasn't making any progress with the current treatment, the talk therapy wasn't doing anything, and I trusted my doctor and there was clinical research, I said yes. And I just kind of fell into it. I got very, very lucky that my therapist was training to be a psychedelic assisted psychotherapist. And I was very privileged to be at the right place at the right time.
Right. Um, the trigger. Uh, well, two questions. Number one, the email you talked about, was it innocuous or was it specific that triggered it?
No,
Just
it
an
was
innocuous email?
it was about needing to get certifications for my job.
Ah,
It
so it
was a
was
level 1 out of like 1 being nothing and 10 being important. It was a level 1.
ah.
Yeah.
And the other question I had was before your husband's passing, and I'm sorry about his passing. Um, did you experience any kind of anxiety or PTSD prior to that?
Well, hindsight is 2020.
Right.
And I will say that a good portion of my work ethic was a trauma response from a childhood of housing and food insecurity on occasion.
Okay.
My childhood was very disruptive. There was not a lot of security in my childhood. And as I look back now, my I'm going to use the word severe. My severe work ethic was all designed to make sure I succeeded in my careers so that I would have a job and money and be safe.
Right.
If you had talked to me then, I would have been like, no, I'm just like type A, go get them, girl. Hindsight's 2020. There was a partial trauma response there.
Right. So you disguised your problem by working, overworking, if you would.
I I can't even tell you that I identified it as a problem. To me,
Hmm.
it was just me.
Hmm. Yeah. So okay. So take us through the therapy exactly, specifically. Uh, how does that work?
What's it like?
Yeah.
So it's super helpful if you think of any other medical procedure or like a surgery. So, and again, I'm an English major, so I keep things easy. 40%. So I went through this particular cycle I'm going to explain 3 times over the course of a year.
Okay.
40% of the time is preparation. 20% is the actual day with the medication. Think of that as like the surgery day, like the procedure day.
Hmm.
And then the other 40% is the healing time. With surgery, it might be like your physical therapy. When you're talking about psychedelics, we often call it an integration period. And so the 40% prep is, what are we going to be working on? For me, it was fear. Do we trust? How do I make sure I trust who I'm working with? So when I actually said yes to this therapy, it was a good 4 months before we actually did the procedure,
I
because
see.
it took me that long to feel comfortable. I already felt comfortable with my therapist, but we had a guide who was experienced with journeying. And remember, my therapist was in a program, so this was her mentor. Well, I had to become comfortable with this person.
Hmm.
So that preparation period, the day of, you go to a location, a journey space, which should be a very comfortable, beautiful place. It should not be a very stark, scary hospital room with beeps. It should be a quiet, serene, beautiful space. For me, it was. lots of comfy blankets. I'm a blanket person, so I
Okay.
loved that. And you should be allowed to bring whatever you want in terms of like comfy socks, a hat, an eye mask, snacks. Like you should be able to bring whatever you want. It will last 5 to 8 hours, and then even a little bit longer when you're coming out of the enhanced state. So it's a long day. And then the period after that is called the integration. And with MDMA for PTSD, very specifically for child abuse,
Hmm.
what the integration looks like is healing memory by memory. And what that means is that, and I'm kind of holding my hands up for people who are listening, I would have childhood memories kind of float into my consciousness, like when you're walking or you're taking a shower and ideas just come to you. And so, for instance, a memory of my 2 foot, my 230 pound, 6'2" father beating 3-year-old Jill, that would kind of float into my consciousness. And instead of the fear, it was, oh, wait a minute, my father was a real blankety blank for doing that. More importantly, the universe is not against me. I don't need to be afraid of everything. The problem was not as a toddler that something is wrong with me and the universe is bad, because of course a caretaker wouldn't do this to me. No, the problem was my father.
Hmm.
And when you start to shift those memories almost one by one, that's when you're healing the PTSD.
I see. So you remembered your father beating you pre TSD, pre traumatic stress. In other words, let's assume your husband's passing was the PTSD event, right?
The work email
Oh,
was
okay,
the
I
actual
see. Okay,
trigger.
yeah,
This, I think the stress of my partner's passing,
okay.
and then the work email, everybody, I don't know about anybody else, but I actually think the second year of a partner's passing is worse than the first year, because the
Hmm.
first year is all widow's fog. The second year is, oh, this person's never coming back, and I'm starting to come out of the widow's fog. And so
Hmm.
that's when that trigger happened. I fully remember, there was nothing that I didn't remember about my childhood. I wasn't
Okay,
one of those people that had undiscovered memories. I just hadn't thought about them for
right.
30 years.
But when you did think about him, or when you did think about him, you had a fear and rather than a analytical look at it. Is that a right
I'm
way?
going to tell you that I did not purposely think about my childhood at all,
Okay,
because
okay,
there was no good in thinking about my childhood.
understood. Yeah. So the middle part of the therapy is that where you get they actually give you
Yep, little
a
capsules.
little capsules. Okay.
Little capsules of MDMA. You have a starter dose, and then an hour in, you have a booster. And everybody can go online to MAPS and they can look at the appropriate dosages. I don't talk about dosages here because people should not be looking to me for medical advice.
Hmm.
Uh, but it's very much according to the patient. You know,
Hmm.
if you don't want the booster, you don't need the booster. And then you're just kind of accepting how the medicine is working. You are not slurring your words. You are aware. You are actively having conversations if you want. Sometimes you might feel like you want the medicine. You might kind of ask a question and you want the medicine to kind of answer it. So you put your eye mask on and you relax. My doctors, I say doctors, guides, therapists, I always mix up what they were. We voice recorded. We had a little glitch in the second journey, but we voice recorded our journeys.
Hmm.
And so it was fascinating listening the next day, because of this like 5 to 8 hour journey. I only remembered like a solid 45 minutes of it.
Right.
So going back and listening and hearing what my subconscious was saying, it was the first time my body was calm enough to tell two people that I knew beyond a shadow of a doubt that if my father was in the room, he would have his hands around my neck trying to kill me,
Hmm.
because that's what he did to my mother at a parent conference. He attacked
Wow.
her.
Wow.
And instead of these two people who would, in a normal conversation, oh my gosh, that's terrible. And oh, that wouldn't happen. And oh, don't worry about it. In a therapeutic process, the goal of those two people are to be empathetic witnesses and to allow the patient to go through that trauma, to kind of talk through it and realize that they are now safe. It's all about being safe.
Right.
So does that help?
Yes. And like you said, you didn't remember the way you were saying. Do you feel like you were under like a hallucinogen? Uh, you said you were conscious for the 5 to 8 hours?
Yes. So MDMA is not, it doesn't produce visuals.
Okay.
So it's not like magic mushrooms where you have these beautiful visuals. MDMA is what people use at the clubs, at
Mm-hmm.
raves. It's a party drug because it's an empathogen. It makes you more open. People call it a heart opener. And for trauma patients, it calms down the amygdala. It calms down the fire alarm of the brain. It releases more serotonin to make us feel good. We actually feel more empathy towards ourselves. We feel more empathy towards other people. We trust other people, which is one of the reasons as a trauma patient who's kind of been scared her whole life or in a PTSD spiral, my body's able to calm down because I have this amazing trust with the people I'm with that I normally would not have if I wasn't in this enhanced state. And that's
Right.
maybe a good way to say it, an enhanced state
Okay.
versus hallucinating.
I got you. But you didn't, you just, for the one reason or another, you just didn't remember what you said when you heard it back the next day. You didn't remember saying it?
Yeah, no, it
Okay.
was it was a lot of talking.
All
Yeah.
right. It's not like we're like sometimes when you, like if you've ever had surgery, like surgery,
Uh,
and they put you under anesthesia, who knows what the hell you're saying when you're coming out of the anesthesia, that was the impression I got when you were telling the story. Yeah.
Parts of it could
Yeah.
very well be. Remember, you're in this particular therapeutic model, you're dealing with some really hard stuff.
Hmm.
Um, yeah, I encourage anybody who's going through this therapy, voice record it. You'll be amazed at what your subconscious talks about.
Right. So the 5 to 8 hours is, I guess they have staff that observe you.
The two people, that's the
Yeah.
whole goal, the two people.
Right.
Yep.
So
Yep.
and it takes 5 to 8 hours. Why the 5 to 8 hours? I guess is a simpler question.
That's how long the MDMA is in your system. That's how long the enhanced state lasts.
I got you.
Uh, I say 5 hours because the very first journey, I kind of shut it down. You actually, psychedelics are not guaranteed of being in a particular kind of state. And so for me, after about 5 hours, like my inner children, I had had enough and I just kind of like snapped awake immediately. And
Hmm.
that's a sign of someone who has a lot of work to do. The first journey for trauma patients is really all about safety. Can I really trust these two people that are here? Because as a child, there were no adults who came and were trustworthy. And
Gotcha.
so at hour 5, like I was done. Once I realized this therapy works, the next two journeys so the first journey was September, the second journey was December, the third journey was May. So we took our time. Those journeys were a solid 7, 8 hours because
I
I
got
wanted
you.
to get as much healing as I could.
Right. Do you feel like talking about it got it off your chest, or does that help too? Being in that state, you were able to talk about it, you said. Do you think actually
Yeah,
verbalizing it helped you?
no. So here's what's really interesting, and it's
Hmm.
super important. It's one of the reasons why there's a lot of reasons why I talk about psychedelics and mental health. Psychedelics and mental health are not turnkey. You don't come out of that journey and immediately feel better. As
Hmm.
a matter of fact, you don't feel different at all. At the end of my first journey, I was crying. I was like, I don't feel better. I wasted everybody's time because I didn't understand how the process works. You almost can't understand it until you go through it.
Hmm.
It was about 2 hours after that journey. I was driving, my boyfriend had come and picked me up. And that's when that first memory showed up and I was able to shift it. And I remember turning to my boyfriend and I was like, oh my gosh, I think I know how this therapy works. So my personal view, this is the way I describe it. It's not so much what you talk about in the journey. It's more like the medicine somehow, and the medicine, when I say MDMA, the medicine somehow marinates the memories that you need to deal with according to your intention. So my intention going in was, I need to deal with this fear.
Mm-hmm.
And so what did it do? The days, weeks, and months, in my case, months of integration, it brought up memories of childhood fear that I needed to heal. So it's
Understood.
kind of like it marinates. And I tell you, my second journey, I talked about a whole bunch of stuff.
Mm-hmm.
No, it's just kind of marinating in your brain. It's just kind of getting to the memories. It's almost like I wrote in the book, it's like the MDMA highlights the memories that it needs to go back to later on in your integration.
Mm.
It's
Well,
fascinating.
I was so absorbed in what you were talking about that I forgot. I'd like to share it with your permission. I'd like to share your webpage, which has your book on it, if that's
Oh,
okay
sure.
with
Yeah.
you.
Yeah.
Um,
People
as
can get
we,
in touch with me.
yeah, as we continue the discussion, I'd like to just show people your website.
That's okay. TheJourneySage.com.
Yeah, I don't know if you can see that.
There
Can you?
I am.
All right, there you go. Um, so, can you describe some of the reasons why the FDA has delayed the approval?
Yeah, I think a couple of things happened. So the first thing you have to, and by the way, I am not in the know. I'm not anyone special. This
Mm-hmm.
is just coming from reading. So the first thing you have to know is that in 2017, the FDA designated MDMA therapy for PTSD as breakthrough, as with the breakthrough designation. And breakthrough designation means that there's nothing else on the market right now that can do what we're seeing in these preliminary findings. So that's a good sign. Additionally, the FDA had been involved in trial design all the way through. So fast forward to 2024, and it seems a little odd all of a sudden that there are all these questions about trial design, very specifically about the unblinding, the idea that people who are in the trial, they know whether they're on a psychedelic or not. You just know.
Mm-hmm.
So that became a concern. I think the second concern, or I shouldn't even put a number in it, just in terms of Jill's order right now, is the fact that the FDA does not approve therapy. The FDA approves drugs.
Mm-hmm.
And in this instance, MDMA by itself does not heal trauma. You need some sort of talking or therapy or coaching or integration support along with it. If MDMA by itself healed trauma, we'd have a whole generation of raver kids without any trauma.
Mm-hmm.
And so I think there was a little bit of a red tape issue, that there was an FDA committee that they couldn't separate MDMA from the therapy, and FDA doesn't regulate therapy. There's a whole licensure group that deals with the therapy part. So the FDA didn't turn around and say, no, we're not approving. They absolutely know that this is a viable option and something that's needed. So they basically said, we need one more trial. They're probably going to deal in some way, shape, or form with the unblinding. And they're probably, my guess is they're going to scale back on the word therapy and somehow, maybe it's just going to be like one or two prep sessions and one or two integration sessions versus like a therapy component. That's my guess. I'm not in the know.
Right.
It's just from me reading. I will tell you, I was really surprised. My personal opinion is I feel like we knew what the criteria was. We got all the way to like, and I'm not a football person, but we got like all the way close to the goal. And then all of a sudden the FDA moved the goalpost. Like that's how it felt to me.
Mm-hmm.
But the underground didn't even blink, because here's the other side of it. When it gets approved, if it's anything like how it's working in Australia, because Australia already approved this, it's been approved for a year in Australia.
I see. Okay.
The barrier to entry to this therapy is probably going to be cost. That in Australia, it's on average $15,000 to $20,000, because it's two therapists a whole day plus all of the therapy that goes along with it, like what I talked about, that whole 80%.
Right.
And unless insurance starts to pick up some of it, that's going to be a barrier of entry to a lot of folks.
Right.
And so the underground that's been doing this work, again, like me, I had this treatment underground. They didn't even blink
Hmm.
because they were like, even if it got approved, there's going to be a whole lot of people who can't afford to go through that process.
Right. And you had mentioned earlier that, well, we both know there's an ongoing problem with PTSD among veterans. Uh, do you have any idea how many of them participated in this particular therapy?
No, because
No.
it's all underground. Yeah, there's nobody. You can do an internet search though and find a good number of YouTube videos of veterans talking about different psychedelics that have helped them with their PTSD.
Hmm.
John, oh gosh, John's last name is completely leaving me now. But he's very vocal. You'll find him talking about his MDMA treatment for PTSD at the top of any YouTube search for it.
Yeah, because that would be a great asset for soldiers that experience PTSD to have, especially, the government should pay for it, in my view. But um,
Well, and I will give credit. The VA, due to some philanthropic groups, is continuing to work is continuing to do research on their own.
mhm,
They didn't stop their research just because of this delay, and I'm really hoping they'll be on the forefront. Everybody knows this can work. Everyone's trying to figure out how we do it in a safe way. Because when you're dealing with opening up somebody's subconscious, you have to have trained professionals. You have to do it in a way that is safe for everybody. You have to screen people. If you have any sort of schizophrenia in your family, any sort of personality disorder, with MDMA specifically, if you have heart issues, you should stay away from psychedelics. So there has to be proper screening. So everyone's looking to make sure that this is a safe modality, however it gets delivered.
right. Well, I'm going to assume there's probably, given the drugs involved, that there's a stigma attached to it, the way it was hard to overcome the stigma attached to medical marijuana, as an example, when that first came on the horizon.
Sure.
Yeah. So
One of
that's
the
a,
reasons, that's why the top of my website is,
yeah.
yeah, demystifying it. Yep.
Yeah. This demystifying. Yes. Yes. And that's overcoming the stigma.
Mm-hmm.
Um, and you did write a book that I'd like to briefly discuss. I know you're not here to push your book, but I think I think I should make our listeners and viewers aware of it. You wrote a book called Rescuing Jill: How MDMA with a Dash of Mushrooms Healed My Childhood Trauma-Induced PTSD. Has that book been received?
If you are someone like me who has experienced childhood trauma,
Hmm.
you get this book. What I did was I wanted to explain the process, and my integration process was a lot of journaling. I was an English teacher way back in the day.
Hmm.
I always thought there was a book in me. And for me, my integration was journaling. So at the end of my year, I actually came out of my third journey knowing work had been done, knowing that something really good had happened. I couldn't put words to it, but I knew healing had really happened after that third one. And I said to my doctors, I need to write about this. I need to tell people how this therapy works, because once it gets approved, there's going to be all this media that it's, 10 years of therapy in 5 hours. And in some ways it is, but you have to put the work in.
Hmm.
And so that's what the book is. The book is the 2 steps forward, 1 step back, the repetition, the going over the childhood memories. And so what I find is that folks who have had some childhood trauma, they get the book. Folks who had a lovely childhood, they find the book repetitive.
I see. Yeah. Yeah.
And that's fine. You can't make everybody happy.
Right.
So it is what it is. The workbook, though, if you are looking at any sort of psychedelic treatment for PTSD, anxiety, depression, I've gone on psychedelic tourism retreats to understand how different medicines work with those particular, for me, it's trauma. And I found people getting really disappointed that they didn't get the results they wanted. And I was like, well, did you prepare? Did you come up with intentions? And they were like, well, what are you talking about? So the workbook is 8 different methods that my therapist and I used during my year to create our healing intentions. And for those of you who are like, I'm not sure what Jill's talking about, the one we used the most, which was talking to the body, that's free. That's a PDF on my website. You can grab that. You can start working with that. And you can start working with that just for regular talk therapy too. It's a beautiful way of kind of accessing some tough trauma that your body is communicating to you.
Hmm. That's how many therapists do you think know about this, utilizing it in their treatment of patients, are aware of it? How many do you think?
Yeah,
Huh.
I don't know that number.
Yeah.
What I can tell you is the MAPS conference last year had over 12,000 people in attendance, and they
Wow.
had an entire track just dedicated to therapists. Like I
Mm.
couldn't even go to that track because I'm not certified as a therapist. So I can't tell you how many people know about it and are doing it because it's underground. But as soon as it's FDA approved, it's going to come above ground very quickly.
Right. So I can't avoid this pun. It's mushrooming, the
It's mushroom.
awareness
There
of
you
it.
go.
Yeah. So what else does well, you mentioned the PDF. If people wanted to reach out to you, they'd be able to do it through this website.
Yeah, there should be a little Calendly that pops up.
A little
Um,
what?
there should be a little, actually, I'm a little bummed. I'm not seeing it. I usually have a little Calendly link that pops up for people to reach out to me. And the
Oh,
fact that,
maybe because I didn't accept your cookie. Is that your cookie?
yeah, that's
Cookie?
just the cookie thing. That's,
Schedule
oh,
time with
yeah,
me. There it is. Yeah,
there you go.
it was blocked by that thing.
There you go.
So and for those that are listening to us, we're on her webpage, thejourneysage.com.
Yeah,
And I'll put a link to it in the show notes for both the video and the audio.
yeah.
And this now I can see it. It explains if you wanted to go down this path, this middle section here will take you to somewhere where you can reach out to someone.
Yeah.
Yeah.
I mean, there are, like, I'm in a psychedelic coaching program right now through Third Wave. And so there are folks like me who are kind of, I mean, ketamine is legal. And in certain states, magic mushrooms or psilocybin is legal. So there are some people that you can work with if you're willing to travel, or if you're willing, if you have a depression diagnosis and want to work with ketamine. And so I have some of those resources on my website that can help people get started.
So the therapists that are involved in this treatment have networked with each other. They
Yep.
can refer someone who's in a state that it's not legal to go to a state that it is legal. Does that make sense? Those
Um, there, I would say that the resources I have people in those states who can deliver those treatments. Is
yes.
probably a better way I would say that.
Okay. All right.
Yeah.
I understand what you're saying. And the
Yeah.
one constant that I've gotten from this conversation, and again, I do appreciate you coming on the show. I think you'll
Ooh,
help a
look
lot
at,
of people.
oh yeah, but I just saw that my little box is a little wonky there, so I
Which
need to
one?
fix that. Keep going, scroll up. Look at that.
Scroll
Look at
up or
that.
down?
I need to fix that. No, I see it. I need to fix those boxes.
Oh,
Thanks
I
for
see
showing me
that
that.
they're not, well, these two on the right are obviously more important because they're taller.
There you go. There you go.
But the one constant I got from this conversation was that it's not a magic pill. It's a pill
Right.
you take in conjunction with intensive treatment on both
Yeah.
ends of taking the pill.
Right.
Right. You broke down the percentages of the actual session, and
Mhm.
the the least percentage was the 5 to 8 hours. Correct.
The actual day up. I know people are always really surprised because they're like, well, that's the psychedelic. That should be like the biggest part. And it's actually not. That's the surgery day. And think about how long it takes you to heal from a major surgery,
Hmm.
you know?
Yeah, and the preparation before the
Mhm.
5 to 8 hour thing.
Yeah.
So what prompted you to like you do podcast appearances? You try to get on as many platforms as you can, and you wrote the book. What's prompting you to do that? Just the belief in the therapy, and you want to share it with others, or?
I'm in a really unique time in my life.
Mhm.
Number one, I'm very privileged that this landed on my in my lap, that I was able to partake in the therapy. Number two, I have an educational technology background. I worked in big tech. And so with my communication skills, with my technology skills, with my creative skills, this was something I really wanted to do. Um, the fact that it worked is important. My mother, her entire life, was clinically depressed. She went through medication after medication, therapist after therapist. She attempted suicide probably more than 8 times in her life. She actually attempted suicide 2 years before she actually died of COPD.
Oh,
And if this therapy had been around, if the Richard Nixon administration hadn't had such a war on drugs and had shut down all of the research, MDMA became illegal later on after Richard Nixon. It became illegal in like the 80s, but he basically started the war on drugs. If more research had been allowed to continue, my mother could have had a very different life.
hmm,
And so for me, seeing something that can work and having the privilege of partaking in it and then being quiet when I have this skill set and I happen to be in a time of my life where I can share it, I thought would be, I just, it would be horrendous not to do so.
right.
So I'm just using the skill set that I have to share what this is. Because again, when it becomes legal, you're going to see amazing marketing that it can do everything and it's a magic pill.
Hmm.
And I want to be a voice of reason and be like, it's really good and you have to do the work.
It's one aspect of the whole treatment. Yeah. Well, I'm so happy you came on because this is very interesting to me, and I hope you keep doing what you're doing. You're doing it for the purest of reasons, which I appreciate. Um, and let's hope it
That's
gets
my
approved.
dog. That
That's your
was my
dog.
dog, girl.
Well,
She
see
passed
now a
away.
lot of people would say that that's good therapy too.
She
Having it,
was.
yeah, yeah.
She was my
So,
integration partner.
gotcha. Yeah, yeah. So again, thanks for coming on, and thanks for
Sure.
sharing your story and filling us in on the. Thanks for demystifying MDA therapy. Thank you. I don't know where I got that from.
And I would just say for
Yes.
folks who are looking for more information,
Hmm.
go to clinicaltrials.gov because
Okay.
that's where more clinical trials are happening. You can sign up for clinical trials. The maps.org site also has clinical trials,
.gov.
and
Clinical trials. .gov.
clinicaltrials.gov, I
.gov.
believe that's correct. An internet search will take you there, and you can actually filter by diagnoses or by psychedelics. Uh, MDMA has breakthrough therapy designation for PTSD. Magic mushrooms has breakthrough designation for depression and anxiety. LSD, I think, also for treatment resistant depression. And then the third thing I say to folks is do a Google alert for trials, because private companies will just kind of post either on LinkedIn or on their social media, and you can't keep track of all the companies. So do a Google alert. And those are my like top ways of getting into trials for folks.
Understood. And I do appreciate you giving this information out, and I hope you continue to do so, because you made me a believer, Jill. So
I demystified it.
there you go. I appreciate you filling us in. So thanks for coming on the show so much, and I will put not only your website but the clinicaltrials.gov in the show notes for the
Yeah,
audience,
help people
and
out.
I'll check the clinicaltrials.gov out myself. All right. Thank you so much, and have a great evening, Jill. Appreciate you coming on.
Take care.
Okay.